Hi, welcome to Straight Talk. I want to welcome all of our new viewers in all the new cities that we're in, and hope that you enjoy the topics and the issues that we bring up on Straight Talk. One of the big issues we've been focusing in on a lot over the last several months is the heroin and opiate epidemic. It's getting worse, not better. It doesn't discriminate. It's happening in every city, county, state, community. Everybody knows somebody involved. And so today we want to talk about different types of treatment, medical treatment for heroin addiction and opiate addiction. And we're going to kind of learn some things that you may not have learned. So if you know somebody that has a problem, this is a good show to watch to learn something about how people are being treated. Joining me first is Dr. Julie Stancliff, who is a psychiatrist, who's been working with these medications for a while, working with addicts. And is it something you love doing?
I do. I never thought I would, but I love it. I love my job every day. Yes.
Are you surprised? I mean, you've been in this field a while, you've been working. Are you surprised at what's going on with this heroin epidemic? How big it grew, how fast it grew?
I would have to say a little bit, yes. I'm a little bit surprised about it. But a couple years ago, we were seeing the opiate prescription pain medications on the rise. And so now that we are taking some control over the prescriptions of opiates, we're seeing more of the heroin and the fentanyl rise.
So people who would get overprescribed or weren't able to get off of their pain meds flipped over to heroin.
Correct.
And then we saw the fentanyl, which everyone hears about, which makes it even worse.
That's correct, yes.
It's a deadly combination.
It sure is.
Let's talk about some of these treatments. When we talk about medical assisted treatment for heroin and opiate, I think most people have no idea what that means.
Correct,
So help
that's
us.
true.
Help us.
Not a problem. So there are three types of medication assisted therapy. The first type is what's called an agonist. So it stimulates that opiate receptor. So an example of a opiate agonist would be methadone. The second type is what's called a partial agonist. So it partially stimulates that opiate receptor and it partially blocks that opiate receptor. And an example of that would be suboxone or Subzol. And then the third type of medication is actually an opiate antagonist. So it does not stimulate an opiate receptor. As a matter of fact, it blocks the receptor, and so the person cannot get high while they are using the vivitrol.
As compared to the other two, suboxone and methadone, where because it's not a total agonist, you can still get high.
Correct, because it's not an antagonist, they can still get high. That is correct,
Okay.
yes.
So this is something kind of on the other end.
That is
Vivitrol.
correct. This is something new, and it's very welcoming, to talk about.
Yeah, I think a lot of people have heard of methadone over the years, and Suboxone has gotten some publicity, but Vivitrol, like you say, it's pretty new.
It is pretty new. It first came out for opiate dependency. It first came out for alcohol dependency, and then has recently received the FDA approval for the opiate dependency.
So I'm a heroin addict, and I come in for treatment, and you say, well, we have Vivitrol. How does it work?
So because it blocks the opiate receptor, the patient has to be detoxed from what they're using. So if they're using heroin, if they're using prescription pain medication, they do have to go through a 7 to 10 day detox period. Mm-hmm. We do not want to inject anyone who's actively using or actively receiving opiate prescription pain medication. If we inject them with the Vivitrol, it will put them in withdrawal. So they have to be clean for a good 7 to 10 days.
And that's what it takes when people talk about withdrawal and detoxification off of heroin and opiates. You're looking at about 7 days.
Typically, we're looking at 7 to 10 days. Mm-hmm. Methadone, however, if people are abusing methadone off the street or are in a methadone clinic and want to switch over to Vivitrol, it may require 14 days, maybe up to 21.
Right.
So methadone's a little bit longer, but typically heroin and other prescription pain medications about 7 to 10 days. Okay. So they do have to be detoxed, which is different from the other medications that are out there.
So then once they're detoxed, then you can sit and begin
Then we can
vivitrol.
begin the process, correct. So it is a process. We do have to obtain some certain blood work before vivitrol is injected. We always obtain for a female pregnancy test because it is not indicated at this point in time for a pregnant female. Once they are medically indicated, then they can receive the vivitrol. It is a once a month injection into the buttocks area or the gluteal area. It is not an opiate, so they can't get high. It is an injection, so they can't divert it. Can't sell it. It has no street value, so to speak.
Right, if you can't get high, why sell it?
That's correct, exactly. And any healthcare provider can actually administer it. In comparison to the other medication-assisted treatment, for the agonist or methadone, you have to be in a methadone clinic.
Right.
For suboxone, you have to go to a type of provider that has a waiver. But for vivitrol, any healthcare provider can be administering it.
So when the person gets that shot of vivitrol and they try to get high,
They cannot feel it.
They go and use up heroin, they're not going to feel the high.
They're not going to feel the high. So they've wasted their time, they've wasted their money, and they've wasted their sobriety day.
Yeah,
That's
that's
correct.
amazing.
It is.
I mean,
It
that's
is.
absolutely. Will other drugs impact vivitrol? Like if they use cocaine or?
So vivitrol is only indicated for opiate
Opiates,
dependency
okay.
and alcohol dependency.
Okay.
So if people are using cocaine or benzodiazepines or marijuana, they're still going to feel those effects.
They would feel that high.
That's correct.
Okay. And it's once a month.
Is once a month.
And then how long can they stay on?
You know, so recovery is kind of an individual journey. So I have had patients be on it for 3 months. I've had patients be on it for a year.
Okay.
It depends on that person.
But it's okay to stay on longer if you need to.
So the studies have been for about 6 months.
Okay.
But in my clinical practice, I have gone up to 12 months on patients. And again, it depends on kind of where they're at in their recovery. Yeah.
Well, this sounds like this is a breakthrough almost. I mean, it's something new and different, and it blocks everything from that. So this is terrific.
It does. And the other kind of major comparison is because it's not an opiate, patients are not going to have all those side effects of an opiate. And so that suppression of breathing is big. And you need to breathe for life.
And that's what makes this so different and unique. So
correct.
Well, thank you for help getting us to understand vivitrol. And we're going to hear more about it, but this was a good Vivitrol 101.
Great.
And I appreciate it. And good luck, and thank you so much for what you do. You help a lot of people.
Thank you.
Thank you. When we come back to Straight Talk, we're going to hear about how this new medication, Vivitrol, is being used in institutions to help people who are behind bars. It's an amazing drug. So stay with us. We're coming right back to Straight Talk.
Your daughter just had her first breakup. Do you A, put yourself in her shoes? B, console her?
Don't worry, sweetie. This is gonna happen a lot.
Or C, find her a new boyfriend?
Nice, single boys. That was weird.
As a parent, there are no perfect answers. But you don't have to be perfect to be a perfect parent. Thousands of teens in foster care will love you just the same.
It's a short ride from your neighborhood to your naturehood. Find fun activities to do, like boating and biking, or camping and hiking, plus much more. To find a neighborhood park or green space near you, visit discovertheforest.org. Don't allow your weight to threaten your health or control your future. Excess weight or obesity can cause emotional and physical health risks. But you can take control. The Your Weight Matters campaign offers free resources and tips to help you measure and understand your weight. Take the Your Weight Matters Challenge. The free toolkit prepares you to speak with a healthcare provider about your weight. Your weight does matter. Take the challenge and take control today.
Hi, welcome back to Straight Talk. We're learning a lot today about a medication that helps people who are addicted to heroin and opiates. It's called vivitrol. And we're finding out that it's a drug that when it gets in your system, you can't get high on another opiate, which is amazing. And hopefully we'll see more of this medication and be able to help a lot more addicts. But it's being used in a lot of different places, including our criminal justice institutions. And joining me now is Rebecca Hogamier, who has been using it for a long, you're one of the first to really get involved with this vivitrol. And now that we're learning about it, I think we should get the message out about it. How did you come about learning about vivitrol? Because you were working in the correction system.
Well, actually, I was working for the Washington County Health Department initially, and I attended a meeting. And at the same time, I was applying for a reentry grant in case management. And I was introduced to vivitrol, and I thought, what a great opportunity to look at recidivism. And you know, grants, they often aren't self-sustaining, but it gives you a chance to try out, to try out theories and practices. And so in 2011, November 2011, Washington County Detention Center partnered with the Washington County Health Department to give the first vivitrol injection inside a local detention center in the whole United States.
Wow, I know, I knew that. It was amazing that you guys would think that far ahead.
Yeah, and it's been, we took a no-show rate of 50% once they get released, and they were court-ordered to go to a community treatment provider. We took that 50%, they were averaging about 50% show rate, and took it up to, I think it was 83%.
Yeah. So when we talk about prisoners, and we know they get drugs in prison and all kinds of stuff, you were using it though as when they were getting ready to leave.
Yes, yes.
That way they would go out, and if they felt like they wanted to use, they couldn't.
That's right.
At least they couldn't use an opiate and get high for that 30 days. So you were kind of giving them a good running start.
Kind of a shot in the arm.
Yeah, and now you found that it really paid off in the end because they did go to treatment.
Yes.
Because they couldn't get high.
Yes. So often what we were seeing is that when somebody got released, they would resume use and their relapse would spin out of control and they would never follow through. Even if they do relapse and use on this medication, it appears, you know, that it doesn't spin out of control and they show up to the treatment door. So initially we started giving multiple doses in jail, and we didn't see any difference in participation in treatment, so we decided to just give that one dose right before they walk out the door. And then a couple years ago, Governor Hogan released $500,000 to local detention centers to replicate Washington County's program. And I had the opportunity to go to, I think there were about 8 or 9 counties, and share with them and teach them how to replicate this program. And we had the opportunity in Washington County Detention Center to expand that. So we were initially giving it to the individuals that were participating in the in-jail program. And then now we are giving it to anybody that indicates that they had an opiate or an alcohol dependency. We give that injection a week before they get released, and then we make a referral.
Have they ever, is it used for anyone that's sentenced for longer, or for people who are actually in jail?
I
to
can't
keep them from getting hold of any illegal drugs?
I can't speak to that.
Yeah.
Washington County Sheriff's...
But you were using it mostly for release.
Yes.
To give them a
yes.
chance
Right.
get back on,
Right.
on the right track.
Now, Washington County has just developed or opened the first day reporting center for Maryland. We opened it in November, and we are using vivitrol for that program as well. And everybody that is participating and is clinically cleared and medically appropriate, we are giving them the vivitrol while they're coming to treatment.
Right. And you were using the injections as we
Yes.
heard before.
Yes, yes. That vivitrol only comes in an injection.
Oh, okay.
That's the only way you can receive that. And as Dr. Stancliff said, it really puts diversion and compliance to rest. You know, compliance is a big issue in our field, having them to show up for treatment, show up for appointments, no matter what it is. So you can take that, your resources, and focus it to the 28th and the 29th and the 30th day, and making sure that you get them in there rather than constantly checking on them to see if they were taking their daily medication. So you can take that resources and focus it just to the end, because that's
Right.
so they can be
Well,
compliant.
it makes sense. I mean, it's, you know, how many people that leave, like you said, are leaving prison and then going right back to the same neighborhood, same friends, same drugs, same environment, nothing changes, and for them to use again is pretty common.
Yep. Well, that's why I decided to use it in the detention center, because it's really difficult to get somebody off of opiates in an outpatient setting without doing the other FDA-approved medications. It's really hard to get them detoxed in order to take the vivitrol. Jail does that for them. So they're put into jail and they detox, and then you give them the injection. And the other thing nice about this, we're hoping to see a decrease in opiate overdoses, because they will resume use, and you know individuals leaving the jail are much higher risk of overdose because they have been abstinent for a period of time.
Well, this is great. Congratulations. And you know, now hopefully people will hear this, and we'll see more and more criminal justice centers and prisons all over the country begin using vivitrol, because it sounds like what you did works, and that's good. So thank you,
Thank you.
for sharing that with us. When we come back to Straight Talk, we're going to talk more about how vivitrol impacts treatment and how they work together, and ultimately to get people off of drugs and to be drug-free. So stay with us. We're coming right back to Straight Talk.
Who helps a hero? Who tells the story of their scars? The freedom and safety of so many, of us all, is earned by the sacrifices of so few. Who helps a hero? We all do. The Gary Sinise Foundation works to support America's defenders and strengthen their families through entertainment, the construction of smart homes for our wounded heroes, and by inspiring and educating others to also support the veterans within their own communities. We enjoy the benefits of their sacrifice and service each day. Now it's time we serve them. Find out how you can help our heroes at GarySiniseFoundation.org. While we can never do enough to show our gratitude to our nation's defenders, we can always do a little more.
Calls me googly eyes.
You know you're beautiful, right? You know that?
Even you're beautiful. I got bullied for wearing glasses. Share if you're against bullying.
We put it out there, just took off. 3 million people have shared this post. Don't let bullies get you down. I stand with you. Our whole family's wearing glasses. I wear glasses and I'm proud.
I even have the army on my team.
All the kind comments brought my child joy. I don't feel thank you is enough.
Thanks.
Hi, welcome back to Straight Talk. We've been talking about a medication to treat addiction, heroin and opiate addiction, called vivitrol. Something pretty new, and we're learning a lot about how it's being used in treatment centers, communities, and it seems to be having some great results. So we want to share that with you because we know every community out there is struggling with this heroin epidemic. And if we've got something that can work, that's good. So joining me now is Zach Snitzer, who is the owner of the Maryland Addiction Recovery Center. And you incorporate vivitrol, but you also have drug-free. You've got a little bit of both.
Sure.
So give us an idea of how you would incorporate like vivitrol in with your treatment program, which is more abstinent-based.
Sure. And I think it's important to say first is there's kind of this black or white mindset sometimes when it comes to treatment where it's either medication-assisted or abstinence-based, and that's not really effective, nor is that really how comprehensive treatment works. Treatment really should be, and it's kind of a buzzword, but really meeting each individual patient where they're at and how you can kind of get them along to some type of path of recovery, whatever that looks like for that individual patient. We have an extended care residential treatment facility, so for us, we get kind of half and half of patients that are coming to us directly from detox, so 7 to 10 days in a detox and then coming right into treatment, or we get a lot of patients that are coming from your traditional 30, 35-day, 28-day residential facility. Both of those, a lot of the patients that are, opioid addicts are candidates for it. What we found in terms of using vivitrol in the best, the best milieu, the best approach is the ones that are coming from the 30-day facilities. If they get that first shot there, we're able then to continue it. We usually continue it for about, I think it was said before, about 6 months. It really gives a very good base for the patients to then really engage in more kind of comprehensive treatment, allows them to deal with a lot of the underlying issues that they're having, mental health issues, trauma, whatever it really is. We haven't, at least in our experience, seen it abused in any way. It really gives a good jump start to somebody and allows them to focus on the major cause, the core issues that they have.
And that's a real big issue, the abuse factor that we've seen over the years, say with methadone and even suboxone. There's lots of stories about it being abused too, but the fact that they can't get high,
Sure.
I mean, that's got to be some motivation for them to say, oh, well, if I can't get high and I'm going to stay on this,
Sure.
maybe.
One of the major things with addiction is really it's a behavioral issue.
Right.
So when you look at a lot of medication, methadone for years, methadone helps a lot of people. It also is abused regularly. Suboxone is another example. Suboxone is right for the right person, but there is an abuse factor. People can get high from it. Not everyone does, but they can. It's the most abused drug, I think, in prisons now. So when you have that aspect of medication, a lot of the times it's really difficult to get to the major issues underlying addiction and then kind of bring a patient to recovery when they're on medication that's regularly abused. I'm not saying everyone does, I'm not saying it happens all the time, but there is that option, and a lot of the times it happens. What we've seen in our experience using vivitrol, that doesn't happen. It really is something where the patient comes in, they get their shot, they are, in terms of their cognitive abilities, their abilities to kind of engage in treatment and deal with those issues, they're there, they're present, they're able to do it, and in terms of its effect on, the physical aspect that it helps, it's taken care of. So it allows us to really get down to the nitty-gritty work.
Yeah, you don't have to worry about the relapse part as much.
Correct. Yeah.
Because you know what I guess the point of length of time, Dr. Stancliff said she had some that were up to a year, 6 months. And your philosophy is whatever.
Our philosophy is really everyone's,
whatever.
It truly is individual. And one of the biggest issues in terms of, in my opinion, addiction treatment for years is that we've been using a lot of these cookie cutter models.
Yeah.
Everything is, this is what works and this is what has to work for everyone, and that's not the case. And obviously we're in the midst of a pandemic. It's not even an epidemic anymore. So we know that that's not the case. So we really need to see what works for that individualized patient. What is their situation? And that is the internal issues that they're dealing with. It's the physical issues that they're dealing with. It's their kind of their external and internal motivation. It's their life skills. It's their ability to find work and as was mentioned before, you know, re-entry into a vocation, a trade, school, whatever it is, their family systems, their environment, all those things need to be, you know, addressed. And if you can take out that abuse factor, if you can take out that, you know, the using factor initially, you can then address all those things. So that's what we found that's why, you know, we prefer in terms of a medication-assisted treatment, vivitrol would be for an opiate or an opioid addict, kind of where we would go initially.
Would you also support the concept of no matter what medication you're on, whether it's methadone or suboxone or vivitrol, that therapy is critical?
Any type
that just getting the medication alone.
The biggest, one of the biggest, not the biggest, or maybe the biggest, one of the biggest issues that we're having in terms of treating addiction is the thought process of medication as treatment.
Right.
Medication is a vital tool in addiction treatment. It is not a magic pill. It will not fix addiction. So any type of medication that's used needs to be used in conjunction with comprehensive services, whether that's a full treatment program, whether that's individual therapy, whether that's psychiatry, whether that's a program, whatever it is. It's 10 spokes in the wheel when you're treating addiction. Medication is one of those spokes. The physical aspect, you know, the way that the brain is reacting, that's one of the spokes, but we need to look at the full wheel.
Yeah. Are you seeing this growing, the vivitrol? It seems to be something fairly new.
Yeah, I mean, we've been using it since we opened. I think there's a push by certain pharmaceutical companies in terms of, you know, with methadone and suboxone and all that. Vivitrol is fairly new, so it takes people time to not only try it out and utilize it, but see what the results are.
Right.
We saw the results fairly early, and we're very happy with them. Patients are very happy with them. Patients' families were very happy with them, which is another big, you know, a big point. So
and you don't see any reaction to the body or any kind of side effects?
We haven't. Again, every medication
a little bit
is different for each person, so it's not right for everyone. Any type of medication, you can't say, oh, you're an opioid addict, take suboxone.
Right.
You're an opioid addict, take vivitrol. It doesn't work that way.
But so far, so good.
But right, so far, so good.
Great. Thank you, Zach, for helping us get that. Today on Straight Talk, we focused on a medication called vivitrol. It seems to be very positive, great feedback. People are using it to help addicts get off of heroin and opiates. If you know someone that has a problem with heroin or opiates, get some help. Call your health department, local treatment center, even your local physician. Someone that's going to help you. It's not going to go away on its own. I want to thank all my guests teaching us about vivitrol. Thank you for watching Straight Talk, and we'll see you next time.